So many people is going around, walking around, going on, doing what they can with anemia without knowing what they are suffering from. In this video, we are going to be talking about anemia, because you may all think that, oh, anemia is not that serious, but the complication can be fatal. Yes, it can lead to severe complications. Anemia can be the reason why you're tired. Reason why you might feel tired or feel fatigued because your muscles are not getting enough oxygenated blood to go on to make you active with your daily activities. Now, this is what happens. There's something in our body known as hemoglobin. Hemoglobin is a very, very vital protein and red blood cells that we have in our body that helps to carry oxygenated blood in our body. It transports oxygenated blood in our body. Now, with iron deficiency anemia, this hemoglobin level is low, and because of this, it makes you feel tired because you're not getting enough. You're not getting the amount you're supposed to get. Another point that you might be having anemia is shortness of breath. In terms of shortness of breath, normally the body, when there's nothing wrong with the oxygenated blood, there's nothing wrong with the hemoglobin, the body gets enough oxygen as it's supposed to. But when it comes to anemia now, the body will not get enough hemoglobin. There's no enough hemoglobin. In order for the body to be able to keep up with the level of oxygen that is needed for you to keep on going, the lungs will breathe more oxygen than usual just so it could meet up with the needs of the body. And because of this, it will result to you breathing heavily, and this is why you have shortness of breath. Another sign is paleness of the skin. Yes, when there is proper supply of oxygenated blood in the body, we have enough of this, you will see that the skin will look healthy, the skin will look pinkish, it's not going to look pale. But reverse is the case. When there is anemia, the skin becomes pale, the skin will not look healthy, and this one will become more visible in the gums, the lips, and also on your nail bed. You'll be able to see that. You see, this my nail is very pinkish, but when there is anemia, it is going to be pale. So if you are experiencing any of these symptoms, if your skin is not popping, is not pinkish, is not looking healthy, or you're seeing that your lip is pale, this might be a sign that you're having anemia. Another symptoms that you might be experiencing when you're having anemia is dizziness and headache. Now, naturally, when the body receives enough oxygenated blood, all other organs in the body, including the brain, receives oxygenated blood, and thereby they function well. In terms of an anemia, when it comes to headache and dizziness, the brain is not getting enough blood as it should, and thereby you're going to have dizziness and headache. In critical situations, when this condition is not being managed, it can result to having some neurological disorders like seizure. It can even lead to low blood pressure, hypotension, because when there is fewer hemoglobin level, definitely there's going to be fewer blood cells in the body, and this will reduce the blood that the body is having, leading to low blood pressure. So this could mean that you're having anemia. Pica syndrome, there's something we call Pica syndrome. Pica syndrome is a situation whereby there is deficiency of iron in the body. Because there is deficiency of iron in the body, now it makes you to be craving some non-nutritional foods like chalk, like dates, ice, even paper. You'll be craving for paper. So these are the signs that you're having anemia. Another sign is chest pain and palpitation. When there is no enough oxygenated blood in the body, it's prompted the heart to keep on pumping blood to meet up with the needs of the body, and because of this, is going to make the heart to race faster, thereby leading to palpitation. In return, because the heart is beeping and pumping out blood, you're going to have chest pain as well. So I know this one I'm about to say, almost everyone would have experienced this. If you have enjoyed this video so far, this is the best time for you to subscribe. Just click on the red button down there and subscribe to the channel if you would like to see more of my content. It is free, guys. You don't have to pay to stay subscribed to the channel. And please like this video because it tells the algorithm that you enjoy the content, and it makes them to push it further for other viewers to say thank you. There are some situations whereby you're seated in a position for a long period of time or for a short period of time, and by the time you get up, you are experiencing some tingling sensation. Now, you can experience tingling sensation in your hand and your feet. Normally, there is supply of oxygenated blood, like I said, to all parts of the body, including your hands and your feet. So now, when it comes to anemia, there is reduced supply of blood to the hand and to the leg. And because of this, you might be experiencing some tingling sensation in your leg. You can also experience cold. Yes, if you don't get enough oxygenated blood in your body, you can experience cold in your feet or on your hand. With iron deficiency anemia, you can have muscle cramping. Yes, you can experience some cramping because of iron deficiency. Now tell me, with all this that I have listed, how can you sleep? This will also result to insomnia, so you'll not be able to sleep very well at night. So all of these symptoms are a reason for you to get checked further, because you don't know what is going on in your body. With iron deficiency anemia, you are at greater risk of having recurrent or frequent infections. Iron plays an important role in maintaining our immune system. When the level is reduced, this will make you to be vulnerable to a lot of infections because the immune system is not in good shape. Apart from the immune system not functioning as it should, there is also an uncommon organ in our body, the spleen. The spleen houses the cells that is defending our body, which is the white blood cells. When the spleen is affected, definitely the white blood cells will be affected as well. And because of this, it can make you to have poor immunity. When you have poor immunity, you are vulnerable to have different infections. With all of this that I have listed, what should you do? The most important thing that I will advise you to do is to consult a doctor. Yes, consult a doctor, because you need to get tested to be sure of your diagnosis, to get diagnosed properly. They cannot base your symptoms or your diagnosis on the symptoms that I have listed. You need to get checked. Your full blood count needs to be done and other tests to be sure that you're suffering from anemia. And as well, ensure that you include foods that are rich in iron to your meals, such as vegetables. And if this video has been helpful, please share to someone that might like this video. Even if they will not like it, share it to them. Please share me out, let other viewers know my channel, and I'll see you in my next video. Bye.